Hey everybody, I am Natalie Paterno with Campbell Family Medicine, and I have with me today
Heather Williams.
And Heather is our
I'm the breast thermography technician and health and wellness coach here
at Campbell Family Medicine. And for those of you who may have missed it, about a month ago or so, we did a huge live announcement, very exciting announcement, and Heather joined our practice at that time, and we did that on Facebook Live, which we were going to actually do this video on live, but we've had major technology challenges. So we're just going to do this and then post it for you all to look at. When we did the announcement, we announced that Heather was joining our team as both the health and wellness coach as well as the thermal breast imaging technician. We got a lot of questions, and Heather got a lot of emails. And so we thought that we would follow up with just answering some of those questions. So I have this beautiful list right here. It looks a lot longer than it is, I promise, with my notes and some questions that you guys have asked, and we thought we would bring them to you and answer those for you. So that's what we're here to do today. If you're not familiar, if you're an established patient or a new patient of Campbell Family Medicine, you may have seen, Katie, if you can pan over this sign. This sign hangs on the door to the thermo room, and it lets everybody know that this is a service that we offer. So if you are in the office, check out that sign and come and ask us questions if we don't address them with you right now. So, Heather, in what you do, one of the questions that people always have and what they always ask is, what is thermography? They want to know. Can you tell them?
Yes, exactly. So basically it's an infrared image of your breast tissue or whatever I'm taking an image of, and it's showing functional process of that tissue as opposed to a structural process.
So with mammography, if I'm understanding what you just said correctly, mammography looks for structural changes in masses. So they're looking for solid things that you may see in the breast tissue. And thermography looks at the changes that are in the tissue before a structural mass occurs.
Yes, exactly. So ultrasound as well as mammography look at structure, and with thermography we can see changes in blood flow and inflammation 5 to 8 years sooner than you might find a structural change on a mammography, according to some of the scientific studies that have been done.
That's pretty awesome. And one of the other questions that we get from ladies is, why would you choose a thermogram over a mammogram?
So sometimes people have trouble with mammography, specifically people who have been diagnosed with dense breast tissue, or people who have had some breast augmentation or
fibrocystic.
Yes, definitely. So sometimes it's easier to have to get an image for those people.
Awesome. Okay, and so thermography should not replace mammogram. Is that correct?
No, I definitely would not say that. You need to have a conversation with your provider about the best choice for you based on your situation.
And another question that we got from a lot of you out there is the preparation for a thermogram. What exactly is involved in that?
Right. So when you make your appointment with Keisha, we're going to put an appointment with the Thermogram technology, and we're going to send you an email that has a questionnaire for you to complete about your medical history, and an instruction sheet that has instructions for you to follow in the days, hours, even months before your exam.
And if I'm correct, that means we don't want to do anything that would excite or inflame that tissue. So no hot coffee, no hot tea, right?
No, we do. Caffeine is a stimulant, and so for at least 2 hours before your thermography, we want to avoid stimulating your body. But also things that are very hot, like saunas, hot showers, tanning, things like that.
What if I was an exercise guru, or I just wanted to go for my run in the morning? Would that be a no-no?
At least for 2 hours before your thermography, I'd ask you not to, yeah.
Okay. All right. And the questionnaire that we get it comes from the lab, right?
It comes from the lab.
And that questionnaire is different from the one that Dr. Campbell asks you to fill out for your annual exam, and so it's something that's required. We should not ignore that.
Please don't. It is helpful to the person who is reading your images because there are so many things that affect our breast tissue, like our hormones and where we are in our life cycle as women. So it's very important for that person to have your information.
And I know when we tried to do this before all the technology challenges, when Keisha was holding the camera, Keisha actually posed a very good question. She said, what about if I'm a lady and I'm in menses or I'm having my menstrual cycle? Does that affect having a thermogram?
Several ladies have complained about feeling very hot during their menstrual cycle, and I know specifically hot flashes can be an issue when I'm doing the thermography images. So if you know that you have issues feeling very hot, I would probably delay your imaging study and reschedule, but you don't have to.
Got it. All right. And another question that we had was women wanted to know, how often are you supposed to do this?
So we recommend an annual exam. If you have one and there are any abnormalities, the person who reads your images will recommend a return date for a rescan.
Awesome. And that comes on my report, and you'll share that with me also, right?
Yes. So I will mail you a copy of your report. They are your results. You own them. And as well as some information about optimal breast health and what you can be doing to your breast tissue and for your body for health.
Awesome. Mm-hmm. Okay, so I actually get to see the images that you saw when you took the pictures then?
Yes.
Those come on the report?
They do. They're all yours.
And then what age? This was another question. A lot of our women we have families, and they were like, well, you know, my mom, my daughter, what age should you start having a thermogram?
So it's published on the website. Probably around the age of 25 is a good start time. But because there's no radiation involved in this exam, it's appropriate for younger women as well, as low as 18. Mm-hmm.
So that actually brings up a very good point. Hello, Mr. Airplane. I'm a cancer survivor. A lot of you already know that, and I don't want to expose myself to unnecessary radiation. So when I had a mammogram, it's just not comfortable. I mean, it's an awful procedure, right? They want to contort your breast and crush it between two plates, and they want to take all these pictures, and you're not standing right, so you have to move and twist. And with thermogram, you don't have that exposure to radiation, and you don't have all that contorting, correct?
That's correct. There is no touching, there's no crushing, there's no radiation, none of that. So when we do your images, I actually am just taking pictures, and I don't have to touch you. And I just literally have you stand like this, and I take your picture. It's very easy.
It sounds a heck of a lot easier. And one of the other questions that we have was, the cold water challenge, right? So why do we do that? We feel at Campbell Family Medicine that's an important part, and actually you should do it, but that's our belief. But why?
So the cold water challenge is used to challenge your autonomic nervous system to make sure that the repeat images I take afterwards reflect that blood flow has been constricted to your breast tissue as it should. Because if there is something growing in there corrupting your blood flow, it's not going to let that constriction happen.
So you do 3 images before, and then you have us place our hands in a bowl of cold. How cold is that water?
It's 50 degrees, and you do it for 1 minute.
Whoa.
It's the most uncomfortable part of the exam, but it is necessary.
But you have a trick.
I have a trick, yes.
So you put our hands in a Ziploc bag so we don't have to put them in that cold water?
That's right. It is not as bad if your hands don't actually get wet.
I would agree with that statement. And that cold water challenge is important because tumors don't like to be cut off. They're ugly, right? And they want to hog all the attention. So doing that cold water challenge allows us to see, because they won't constrict that blood flow, right?
That's exactly right. Mm-hmm.
So the cold water challenge, when you do that, your body's response is to preserve heat to the head and to the heart.
Right.
And to the tumor, I guess, if there's one there.
Right.
Wouldn't that be right?
The tumor is going to corrupt the blood flow and be very selfish.
So we can see that on those images, or they can. The lab can.
The lab can. I don't do the interpreting, but the lab technician can do that for you.
That's pretty cool. Mm-hmm. And then last but not least, how long does it take to get results?
So typically it takes about a week or two to get your results. I will mail them to you along with some education. During the time of our special, the result period will take a little bit longer. I'd add a week or two, just because the lab is going to be inundated for Breast Health Awareness Month.
Which, by the way, Breast Health Awareness Month, we can talk today on a Friday afternoon, is a month that we celebrate the health and wellness of the breasts in our practice. And we do that by offering a special for thermography. And right now the special is $50 off.
That's right.
You have a coupon. Let me see that. Where's that at?
do
I know
have
it's in your, I knew you carried it. So, oops.
Oh,
Let's try again.
Next.
That's what happens when you're outside. So this is the coupon. So, and it entitles you to get $50 off of your thermography service during the month of breast health awareness here at Campbell Family Medicine. Please feel free to share this video with anyone you know or care about or have concerns about, or who wants to get insight and answers into their breast health. We also screen men.
We do.
So, believe it or not, breast cancer is found in men as well. A lot of people don't know that, but the statistics are rising. Because I think probably the world that we live in, among other things. So don't forget your guys too. Please share this message, and we are happy to help and to serve you, and we would love to see you in our practice. We will tell you that our October or Breast Health Awareness Month is pretty busy. I know Keisha said we're filling up, but we do have appointments available. We usually scan between 80 and 100 sets of breasts on that month. So let yours be one of those that we scan. We would love to see you in our office. You can actually call us at 678-474-4742, or you can email Miss Heather. What's your email?
It's thermo.cfm@gmail.com.
With any questions, concerns, or anything else you would like to ask. I hope we've addressed and answered some of your questions. If not, you just got our contact information, and we can't wait to see you and your boobs in our office.